Hi, my name is Christian Hoban, and I'm the instructor for the Advanced Dynamic Anatomy course. So with this course, we really wanted to find kind of the gap between what schools teach you for anatomy and some of the missing pieces that school kind of leaves out. So when I was in school, they really focused on origin, insertion, action, nerve, that kind of goes to the muscle and innervates the muscle. But I felt like we really left out the functional component of what the muscle does. So this course wanted to try and bridge the gap between, okay, we should know where muscle is, where it goes, and then action-wise what the main action of the muscle is, but functionally, when a patient comes in your clinic, they're not going to usually complain about the action of the muscle. They're going to complain about a functional component that's going wrong with the movement pattern. Another thing that I noticed in school a lot of time is that, in my school especially, we were taught if a muscle's tight, to stretch it, if a muscle is weak, to strengthen it. In this course, we'll go over a little bit more about hypertonicity, hypotonicity of muscles. So you'll learn that sometimes what's actually going on is a muscle is really tight in the front of the hip, creating an inhibition in the glutes in the back of the hip. So I've had before where you go manual muscle test a patient and they're presenting as like a 3+, 4- out of 5 on a manual muscle test. And then you go in and treat a hypertonic tissue, retest that same tissue, and again, get strength out of it. So that concept just shows that even with, a muscle being tight, weak, or again, inhibited, there is a difference in concepts with that. Now in this course, we're also going to start with some lecture-based topics. So we'll go over palpation principles, making sure that you're palpating muscles with intent. We'll go over pain pathways, so difference between nociceptive and proprioceptive systems. We'll take some key topics like tendinitis, tendinosis, and then kind of go further in depth on like what causes those and the actual breakdowns of the tissues. We'll go over muscle strain etiologies, and then obviously the most important thing, how do these things relate to function? Because again, when your patient's coming in, usually they're not saying something's wrong just with an action or a certain specific movement. It's the whole functional pattern of movements. And then the most fun part of the course, again, obviously the lab. So in the lab, we're going to go over each muscles for upper extremities. We'll go over lower extremities, trunk, neck. That way you have a really good in-depth understanding of, again, where you're palpating, why you're palpating that tissue, and then correlate that tissue to a function. So, one of the key takeaways you should be able to get out of the class is Monday morning when you go into work, you should know what tissue you're palpating, be able to describe to the patient why it's important you're palpating that tissue. And then, again, this isn't a treatment-focused course, but we'll try and give you little tips and tricks that you can do for certain muscle tissues and certain pain pathways. That way you can describe to patients, hey, this muscle's tender because of this. I want to treat it to find out if this gets better with this motion. So, a lot of times in PT, especially, we forget to do a lot of test, treat, retest. So in this course, we'll just describe the whole pathway of finding a tender muscle, finding the 2 or 3 key drivers at the muscle, and then how do we find out, from a muscle attachment standpoint, a synergist standpoint, a biomechanical standpoint, or a joint structure standpoint, what might be causing that muscle dysfunction. That way you can fully treat and get that patient better. And again, they'll trust you knowing that you know that whole pathway, and you can show them each step of the way, like, hey, I'm going to palpate this muscle, there's tenderness, now let me treat it, test it again. If they see a 40-50% improvement in range of motion or strength, they're going to trust you way more to want to do their home program. They're going to want to do more of their stuff the next session they come in. So super, super important to get that kind of focus out of this class too. That should give you a good description of what the class is and kind of what you'll get out of the class. So hopefully we'll see you soon in the future.